MyStory, MyJourney, YourAwareness, which is aimed at promoting early cancer diagnosis for the population of Wirral and also across tertiary Merseyside. This is one of the community partnership programs between Tertiary Merseyside Cancer Alliance and local CVS across the region.
Hi, my name is Aline. I am 69 years old. I live on the Wirral and I work on the Wirral, but I was born in the Netherlands.
My name is Ram Vinayagam. I'm a consultant oncoplastic breast surgeon and clinical lead for breast surgery and breast unit based at Clatterbridge General Hospital, which comes under the umbrella of Wirral University Teaching Hospital NHS Foundation Trust. Why breast cancer and the diagnosis, the treatment, early diagnosis is important. Breast cancer is the commonest cancer at the moment in UK. It used to be lung cancer, now it's the breast cancer is the commonest cancer. And 1 in 7 women get breast cancer in their lifetime. And the vast majority of the women, they haven't done anything wrong. They are perfectly healthy women and they're diagnosed with breast cancer. That's what more heartbreaking and upsetting for not only for the patient, the woman, and the whole family. However, in the last couple of decades, the breast cancer treatment and survival has doubled up. More and more women are living longer after breast cancer diagnosis and treatment, and most women don't die from breast cancer, they die of natural causes. But the most important thing is diagnosing it early. If I diagnose the cancer early, almost all women live for at least 5 years.
There was breast cancer in my family. 2 of my sisters had already had breast cancer. I had no symptoms at all, but I was asked at the age of 40 if I wanted to take part in an age trial. And that meant that on a yearly basis I would get a mammogram. And obviously I agreed to that. I had no symptoms, and from 1 year to the next I was told that I had cancer, and it was a flat tumour, stage 3. I had already planned to go on holiday because it was just before Christmas, and my surgeon said it would be better if I had at least the operation before I went on holiday, which I wasn't keen on, but I was persuaded. And I then needed a second operation because they hadn't taken everything away. And then I started with radiotherapy. After the radiotherapy, the oncologist suggested that I would go on tamoxifen because I had a estrogen positive tumour. But after about 6 months of being on tamoxifen, I really didn't feel well. And after discussion, and it was not at that stage that I spoke to the consultant, but one of the registrars, and I was offered different medication, Arimidex. When I got that home, I read that that was for women postmenopausal, which I was not. So I contacted and I was said no, it was fine. I can't actually bring on the words the fact that I am convinced if I hadn't been offered to participate in an age trial, which meant that I had a mammogram every year from the age of 40, that I would still be sitting here because my tumour was stage 3, but it was a flat tumour and I had no symptoms whatsoever. So for me, it's so important that not only do you check yourself regularly, even the slightest tingling, change of colour, anything like that, just go and see your GP, because you will be able to survive if you have cancer and it's detected early.
So with the early dissection, the most important thing is knowing how your breast looks and how your breast feels, because every woman's breast is different. How much breast tissue they have, how much fat tissue they have, the consistency, where they are distributed, it can feel different for each woman. So you need to know what is right for you. The right time to look for is after your periods, where the breast will be more calmer, it won't be engorged, so you'll be able to feel how the breast feels. what is normal for you, which area feels softer, which area feels firmer for you. Is it feeling same every month? Then that's absolutely fine. But anything different, you're feeling a lump or a thickening, or there's change in the skin, change in the nipple, the rash, the breast has unusually gone bigger, smaller. So anything you're not sure about, go to the GP. The GP should be able to identify there's anything going on, then you can refer to a specialist, which we will see very, very quickly. All women refer to us on usually within 2 weeks, if not maximum 4 weeks. We will take care from there. As I said again, 9 out of 10 are benign. So don't panic and stay at home. There is something terrible going on. Come and get checked. If there is something needs treating, if you find early, then we can treat it better. Lesser treatment you will need, and your prognosis will be much, much, much better, and you can lead a healthy life.